weren't sure who we were fighting at the time. You know, I guess in the back of my mind, being a young infantryman, I thought for sure we'd engage directly with the enemy, and that certainly wasn't the case. And so during this time was really when the proliferation of IEDs, or improvised explosive devices, started. We had no idea initially what we were getting into, and so the protocol at that time was just being developed. And so you can imagine the amount of traffic and the logistics coming in and out of Baghdad, just supplying all those operations. And so our main task was to keep those routes open, provide security, make sure they weren't ambushed, but most importantly, keeping them clear of IEDs. And so I vividly remember our platoon, our company, patrolling these routes on foot in the middle of the night, kicking trash, looking for improvised explosive devices. And then the first detonation that I had, it was the middle of the day. I was driving the vehicle at the time, and I don't think on my model, this is the driver's hatch. And so my hatch was up, I was looking out the hatch, I had goggles on, a Kevlar helmet, and the middle of this farm area, an agricultural area, and the detonation occurred on this side of the vehicle, and a pretty large one to say the least. At that time it killed the vehicle. I had pieces of dirt embedded in my face, thankfully nothing more than that. That was the first encounter that we had, or that I had, with an improvised explosive device, the first of 8 that I would experience during my 10 months in country. At 19 years old, what made me do what I did day in and day out, and ultimately determined it was really 2 things when you boil it down. And the first is the mission that you serve, serving something that's bigger and greater than yourself. And then the second thing, probably more important than the first, is the people that I served with. Because if they were going to put themselves in harm's way, there's no way in hell that they were going to do it by themselves. And so in a lot of ways, the parallels between military service and those 2 components are what draw me to serving healthcare, because we serve such an important mission of delivering that healthcare to our community, and then I'm privileged to serve with some people that are just amazing in how they deliver that.